I imagine many of you here situationally to understand what was announced yesterday in more detail and specificity as it relates to the first, apparently, first community-sourced transfer of the virus. I want to first, though, contextualize this moment and contextualize California's role as it relates to the issue that is in front of us. I've been very proud to be a resident of this great state for over 50 years. The privilege of growing up in and around San Francisco through the HIV and AIDS epidemic. I saw firsthand the incredible capacity and resolve and compassion, empathy, drive, the innovative spirit that defined our march to meet those moments in the past. How richly resourced we were, not just financially, but in spirit and in resolve. I had the opportunity over the course of decades in public service as a county supervisor and as mayor of a county, San Francisco, to work very closely and collaboratively with the state of California, federal agencies to address issues large and small, issues around MERS and SARS, issues around H5N1, not just H1N1, issues around Ebola and our response to those situational challenges and crises. I saw firsthand the incredible expertise and commitment and resolve of people at all levels of government. And as a consequence, many of those things are in our rear view mirror as it relates to the acuity of our consciousness and focus. Accordingly, we'll meet this moment. We will express and advance similar resolve on the issue of this novel coronavirus. And we will accordingly attach ourselves to a little bit of understanding of our history and our capacity to meet pandemics head on, both in pre-planning, both addressing pandemic in real time, and more importantly, in many respects, post-pandemic. Over the course of decades, now the state of California formally has adopted some renewed strategies. And those strategies are advanced on an annual basis through formal efforts at the local level, regional, state, and federal level to work to build capacity and build partnerships. The state of California invests millions of dollars a year to require communities, large and small in this state, to advance protocols, to do very comprehensive annual event plans, and to continue to develop relationships, not just develop policies and planning documents. Relationships and trust, at the end of the day, matter more than anything else. We had a number of those, by the way, conducted at scale last November. It was just a month or so later, last December, that we first were afforded the opportunity to learn more about what was happening overseas in Asia. I'm very proud of being a former mayor of San Francisco with the first and largest Chinatown in the United States, one of the largest Chinese populations, Asian populations, more broadly defined per capita, and they are part of our country, accordingly being governor of the most diverse state in the world's most diverse democracy, also affords us a capacity of understanding and, again, strong formal relationships that have been developed over the course of decades. Those relationships allowed us to advance in real time an understanding and scoping of the challenge that inevitably would be presented. We worked more formally with the Trump administration and continue to work formally and very collaboratively with the Trump administration at all levels to coordinate and collaborate. That coordination and collaboration, you may recall, initiated in a number of repatriation flights that came to the United States. And rather than turning our backs on those repatriation flights, we supported with partnerships at CDC and other federal agencies those repatriation efforts as American citizens first, as Californians advancing our values second. And we coordinated those first flights, the first flight in particular, in January, late January, down into Riverside at Marsh. We've had a number of other flights, including the most recent at Travis Air Force Base in Solano County. Over 800 people have come in on those flights, but that's a small part of the overall picture. Thousands and thousands of other people have come in on more traditional flights through the state of California. Some 8,400 plus are currently being monitored with 49 local jurisdictions doing those protocols and monitoring as it relates to more traditional commercial flights that came in from points of concern and potential points of contact, particularly in Asia. As you may know, as of today, and I say as of today at this hour, we have 33 confirmed positive tests for the virus. 5 individuals have subsequently moved out of state. So there are 28 people that we know in the state of California that are positive. The case yesterday, understandably, generated a lot of attention, but didn't surprise any of the folks standing to my left or right. We knew this was inevitable as it relates to the nature, the epidemiology, the nature of these viruses, that incident would occur. Accordingly, when hearing about it, we initiated a series of protocols that we were prepared to advance. Those protocols include deep tracking and tracing of individuals that would be in contact with this individual, working, again, in collaboration and partnership with our federal partners, and working with the extraordinarily talented and committed frontline workers, both in the healthcare sector, but more broadly defined at the local and county level. We are currently in deep partnership with CDC on one overriding protocol that drives our principal focus right now, and that's testing, and the importance to increase our testing protocols and to have point-of-contact diagnostic testing as our top priority, not just in the state of California, but I imagine all across the United States. We had conversations just, I don't want to say moments ago, but within the last few hours with CDC, assuring us that the testing protocols will be advanced with urgency. We have just a few hundred testing kits in the state of California, and that's surveillance testing as well as diagnostic testing. That's simply inadequate to do justice to the kind of testing that is required to address this issue head on. And I'm very pleased that the CDC is moving expeditiously on that and have made firm commitments to the state of California that will significantly and exponentially expand our capacity to advance those testing protocols. Nothing more important than point-of-contact diagnostic testing that can be readily made available so that we can have full spectrum testing of this disease. And so that is, or rather of this virus. And so that's our top priority as it relates to the moment. And again, we are pleased with the response that we have just received from our representatives, the federal government. We have today, though, representatives from a number of state agencies that will talk more learnedly and more specifically about the protocols and procedures that are underway as it relates to modeling this virus in this state, looking at vaccine protocols, when, not if, when the vaccine avails itself, looking at the strategies of cooperation at a multi-jurisdictional level, be it not just with state and local and federal officials, but also nonprofits, NGOs, and private sector participants. That's why we have assembled here today the head of our Health and Human Service Agency, who will speak just after me. He'll hand it off to Dr. Angel, who represents public health system and someone many of you in California are quite familiar with, the head of our Office of Emergency Services, not to elevate anxiety in relationship to the Office of Emergency Services, but our leader as it relates to wildfires and relating to natural disasters, but also our leader in logistics as it relates to the modeling and gaming out of our next phase strategies if they are necessary. I long-windedly have just said the following. We're meeting this moment. We have been in constant contact with federal agencies. We have history and expertise in this space. We are not overreacting, but nor are we underreacting to the understandable anxiety many people have as it relates to this novel virus. At the same time, no better resource state in America to address this issue head on, and no better team assembled that have taken account and responsibility from day one to meet this moment. So it's in that spirit that I now will ask Dr. Galley to come up and express his points of view, and he will pass his podium on to the two other representatives of agencies, and we're here, of course, to answer any question you subsequently may have. Dr. Galley.
Thank you. Thank you, Governor. My name is Dr. Mark Galley. I'm Secretary for California's Health and Human Services Agency. Today, I want to walk through what we, alongside our colleagues at the Governor's Office, Cal OES, our local partners, our private partners in the hospital system, the clinic system, our many physicians and nurses across the state have been working towards, as well as our great partnership with the CDC and other federal agencies. We are here and have been doing our work around the clock for many weeks and months now to protect California's health and safety since we first learned about the novel coronavirus. I will then turn this over to Dr. Sonia Angel, to my right, who is our California Public Health Officer, who is also the Director of the California Department of Public Health, and she will go into more detail about specifics on the particular case that I know many of you are interested in learning more about. I do want to spend a moment just setting a bit of a ground rule around what we'll do here today. As a physician, along with Dr. Angel, we take very seriously patient privacy. We may not be able to be in a position to answer questions about the most recent case when it comes to the condition of the patient, their age, and where they are. We are also not going to be discussing in great detail issues around the federal repatriation efforts. As many of you are aware, we are in active conversations and in litigation around that with our federal partners and the local entities. I want to start by saying it's natural to feel concerned about the novel coronavirus, but I want Californians to know that we have rigorously planned for this public health event. Just like this, as the governor mentioned, when I was with him in San Francisco, we prepared for the H1N1 situation. We've gone through this with Ebola and being prepared, and many other events like it in the past. And our goal is to take every precaution to protect California's health and safety. This is a rapidly evolving situation. We are leveraging all the necessary state resources to address it. We are in constant communication with our federal partners. And yes, it was just moments ago that we were on with the CDC's director learning about our ability to expand testing here in the state, to receive more testing kits, and to be in active conversation on redefining what triggers a situation, a clinical situation, to be tested. California continues to be an active partner with the federal government, helping lots of impacted Americans get home. As the governor said, we welcomed home the first of many flights to the state. We have been participating with all of our public health resources, our clinical resources, to support those federal efforts. We are the first in the nation to begin to roll out testing, and we are going to be expanding that in the hours to come. We have been actively and extensively planning with our local health partners. That includes our delivery system. The hospitals and doctors and nurses that we all trust have been deeply engaged. I'm grateful for those wonderful partnerships and relationships we have with those agencies and organizations across the state, because those relationships matter at a moment like this. It makes it more seamless and gives us a better chance to be prepared, as we have experienced in the last many weeks. As in any public health event, our Medical and Health Coordination Center has been activated and is coordinating its response across the state and preparing for more and possible community transmission. California continues to prepare and respond in coordination with even our local hospitals in Solano County and in many other counties that have stepped to the plate and really taken on a clinical load that weeks ago wasn't anticipated. We are providing information, guidance in documents and in technical assistance in regular phone calls and webinars with all of our state partners who need to continue to work with us to make sure that we have the best interest of all Californians in mind. This includes guidance to facilities such as schools, universities, colleges, child care centers all across California, because the questions are many and we want to make sure we give a consistent and clear voice. We continue to coordinate with the federal authorities and local health departments in implementing screening, monitoring, and in some cases quarantine. We've had over 8,000 passengers returning to the U.S. from China and other parts of Asia over the past many weeks, and we have supported and worked with our local health departments to make sure those individuals are safe and that we are giving good and appropriate guidance based on the most up-to-date information. We are continuing to work with our federal partners on giving our feedback on all of their guidance and criteria so that we make sure that it is current and meets the needs of an evolving situation. We look forward to continuing those strong relationships, and we are working hard to ensure that our local health capacity is preserved for those individuals with significant symptoms if that is developed. So we are working hard to make sure that our local health partners are communicating accurately when people who are experiencing symptoms, whether they've had exposure or not, should be emerging and coming forward to health facilities. We live in an age where telehealth, telemedicine, phone advice, many other types of modes of getting information and sharing your clinical condition exist, and we are urging many folks to use that before they come to emergency rooms or urgent care centers or their physicians' practices, in order that we ensure that the hospitals and our capacity during a important time in flu season and when other emerging other patients with clinical needs would naturally use the emergency rooms. So we're trying to work hard with those partners to make sure that we use our scarce but critical access within our acute care hospitals in the most responsible and appropriate manner. I will now turn to Dr. Sonia Angel, who will go into more detail about the sort of state of affairs of coronavirus across the globe, across the nation, in our state, and some of the specifics on the important development from yesterday. Dr. Angel?
Thank you. Hi, good morning. I'm Dr. Sonia Angel. I'm Director of the California Department of Public Health and State Public Health Officer, and I'm welcoming you all today here to our Medical Health Coordination Center. This is where we coordinate with all of our agencies a very important response that we've put in place for novel coronavirus, otherwise known as COVID-19. Novel coronavirus, COVID-19, is new, but it is part of a family of coronaviruses that have been around for a long time that we are very familiar with. In fact, coronaviruses are responsible for the common cold, so it's something that all of you may also be quite familiar with. The cause of the current outbreak that originated in China is a new member of this family. The most common symptoms of COVID-19 include fever, cough, and shortness of breath. Our experience to date, though, is that most people, more than 85%, will have mild or no symptoms. Some may move to a more complicated course, including pneumonia, but that is not the most common manifestation of novel coronavirus. We're learning more about its transmission, and as I said, the most common symptoms are respiratory. Therefore, its primary mode of transmission is from coughing or sneezing, particularly when we don't cover our mouths after we sneeze or cough or don't wash our hands. There have been a limited number of confirmed cases of COVID-19 in California to date, as mentioned. 33 positive cases in California, 24 were from the repatriation flights. The other 9 confirmed cases include 7 that are travel-related, 1 due to person-to-person contact, but that was from a very close contact a spouse living in the home, and now, as mentioned yesterday, this new case from an unknown source. This particular case could be the first possible instance of community transmission of COVID-19 in the United States, and it's here in California. It's in an individual in Solano County who is receiving care in Sacramento County with no travel history and no known exposure to somebody with confirmed COVID-19. We currently have people in the field working in the community at the local, from the state, and also from the CDC. They're investigating the cases and they're taking action. They're contacting any individuals who might have been exposed and they're isolating them. This is a fluid situation at this time, and I want to emphasize that the risk to the general public remains low. In the event that that risk changes, we will communicate with you. We will make everyone aware. But it's important to note that the risk to the general public in California remains low from novel coronavirus. The Department of Public Health's Emergency Operations Center has been actively coordinating response efforts, preparing for possible community transmission. As always in emergencies, we plan for both the worst situation, but also the best situation. So we're ready for anything. We've been working with our state and local partners for situations like this for over a decade. We've updated our plans based upon our lessons that we learned from H1N1 and from Ebola virus. But we do realize that this case that we're discussing today marks a turning point. And as such, we're expanding our surveillance activities. We're increasing our laboratory capacity, as mentioned, with more testing. We're planning increased demands on our medical system. And we're using the latest science to model and forecast the needs of our community so that we are sure we can continue to respond as we have to date. As we learn more about COVID-19 and how it evolves, we will be sure that we adapt whatever we're doing to make sure that our responses are appropriate. And as we continue to work in coordination with federal and local partners, there are some simple steps that I want to remind all of you, we'll all emphasize this, that you can do today to make sure that you stay safe and to protect yourself. And those include washing your hands with soap and water, avoiding touching your eyes, nose or mouth with unwashed hands, staying at home from work or school if you become sick with respiratory symptoms like a fever or cough, and avoiding close contact with people who are sick. It's natural to be concerned at times like this, which is why California officials have been closely monitoring and working with partners around this situation.